Crack cocaine first became popular in the United States in the 1980s. The population of people who smoked this drug was very diverse. It included both the young and the old, male and female, the lower and the upper class. Professional drug addiction counselor Reverend David Kaywood stated that 8 million Americans in the 1980s used crack cocaine on a regular basis, and 8% of these individuals were extremely dependent on the drug. Part of this population of drug users also includes expecting mothers. In 1998, it was estimated that between 30,000 and 50,000 babies each year were born to mothers who used crack at some point during their pregnancy. So you might be asking yourself, what exactly are the effects of crack cocaine on pregnancy, both to the unborn child and the newborn child? Let's take a look at both of these aspects. The two most common effects crack cocaine has on unborn children are miscarriage and premature labor. When a pregnant woman smokes crack, the drug enters into her bloodstream and goes throughout her entire body, which means that it goes straight to her baby as well. The drug blocks symptoms such as hunger and fatigue, which put extreme nutritional and stress factors on her child and on herself. Lack of oxygen and nutrient flow to the fetus can cause serious health problems, which can result in brain damage and other permanent physical and mental disabilities as well. Also, a lack of oxygen and nutrients can cause premature birth, which has its own risk and health factors. A condition called placental abruption, which happens when the placenta detaches from the uterine wall before labor actually begins, is another cause of problems resulted from crack cocaine. It can cause extreme bleeding, which can cause health problems and sometimes even death for the mother and the unborn child. Although crack usage is definitely a factor in fetal deaths, according to Jennifer James, a member of the Do It Now Foundation, there is really no true and known factor or reason why crack causes so many fetal deaths. However, fetal deaths is 10 times more likely to occur with women who have used crack at some point during their pregnancy than women who have not used the drug at all. So not only does the use of crack by an expecting mother affect the unborn child, but it affects the newborn child as well once the mother has given birth. The most common risk factor for newborn children because of crack is a low birth weight. According to addiction and recovery and relapse counselor Terrence Gorski, low birth weight can result from poor growth before birth, premature birth, or a combination of the two. Also, low birth weight babies are 20 times more likely to die during their first month of living than those children who were born with normal birth rates. Medical students did a study and research at a hospital about children who were born to mothers who had done crack during their pregnancy. The students recounted that the newborns who were exposed to crack looked like normal babies but did not act like them. The cocaine-exposed infants were jittery, had more muscle tension, and were harder to move because they were so very stiff. Newborns oftentimes also have trouble with feeding and sleeping because of the effects of the drug. They also are very oversensitive to touch and other stimuli, are hard to soothe and cry a lot, or go to the other extreme and never cry at all. All of these factors are a result from the child going through withdrawal from the drug, just as an adult would if they stopped taking an addictive substance as well. Oftentimes, bonding between the mother and child is affected as well. And many researchers have shown that bonding between a mother and child after birth is very crucial to the cognitive development and sensitivity of the child. Barry Lesser, a professor of psychiatry and pediatrics, stated, "A baby that isn't cuddly sweet can turn off a parent. For a drug-using mom, this is a real setup for failure, as problems with a baby and mother can trigger negative parenting. The trick to get these mothers back on track with their parenting is psychiatric and addiction counseling. After hearing about the horrible effects of crack cocaine on mothers, their unborn child, and their newborn child, you're probably wondering, what can we do? What is the solution to this problem? Is there even a solution? The most obvious thought is to try and get individuals from stopping using addictive substances of any kind. Most idealistically is to help individuals stop using substances before they get pregnant, or if they're refusing to stop taking a substance such as crack cocaine, then to help them prevent getting pregnant at all, to reduce the effects of their child having problems or them having problems as well. Also, if someone who is addicted to crack becomes pregnant, it is important to help them stop taking the substance as soon as possible and get them some help. This can help reduce their child from having difficulties or causing miscarriages for the mother or even premature labor. Would the child still be affected? Probably somewhat, yes, but stopping soon would cause for further damage. When it comes to smoking crack or doing any other kind of substance, including alcohol, while pregnant, it is wrong. It is never okay to do so. It is important for those who might be taking a substance while pregnant to realize their error of their ways and to reach out for help. There are plenty of organizations and loving people out there who are willing to help you overcome your problems and make a better life for you and your child. Also, it is important that if you know someone who is addicted to a substance, that you could help them overcome their problem. Reach out to them, let them know that they are loved, and help them in their time of need. Okay, these are my audience members, Janelle and Ben.